Vanessa, we'll start with you. As always, when we have you on, since you're coming from the Department of Public Health, we would like to know about where we stand on vaccinations, statistically speaking, here in Colorado.
Thank you, Chris. Actually, right now, we have 205 new cases reported, 20 new deaths among cases reported, 135 persons currently hospitalized for confirmed COVID-19, and 67% of those currently hospitalized are unvaccinated. They are not vaccinated. 29 number of new hospital admissions, 3.33% of the 7-day moving average positivity rate. This has increased slightly from last week. And let's remember that the state goal is under 5%. So those are the numbers so far. And in regards to the Hispanic community, like we said in previous weeks, it's moving, it's slowly moving. And up to date, we have reported from the Hispanic community a total of 39.69% of people vaccinated. And according to the model report, based on race and ethnicity, because there are some people that they don't report their race or ethnicity when they get vaccinated. So according to the model, it will be 47.78% of the Hispanic people vaccinated.
Well, hopefully that is a number that we can continue to grow in the coming weeks, months, and weeks and months. Dr. González-Fisher, I think big COVID news on the top of our minds at this point was today the CDC approved a fourth vaccine for adults 50 years of age or older. What do we know about the fourth vaccine, and when should it be available and perhaps taken?
Thank you, Chris. Thank you, Vanessa. What we need to know is that the FDA approved the use of a fourth COVID-19 vaccine if you receive a booster of Pfizer or Moderna. This is based on studies that have been following up that were happening in Israel with people who received a solid organ transplant, the kidney or heart, lung, liver, and who didn't achieve the immunity or the increase on the antibodies that we expected with the booster. So you start with the fourth vaccine. So now the FDA approved that people in the United States who are 50 years or older can receive a fourth shot, a booster, and also certain populations of interest like children 11 and older, or who can receive Moderna, or people with, can receive Pfizer, and people 18 and older can receive Moderna if they have underlying condition that affects their immune system, such as a solid organ transplant, such as immunodeficiency caused by a virus or another cause, for example, chemotherapy. These studies have been followed up seriously. They've been following close to 700,000 people, and they identified that there's not an increased risk by receiving a fourth dose, but there is an increase in the antibodies and the protection that they can get.
Now, maybe a bit more of a general question here. In order to get your vaccine, whether it be your first dose, your third dose, your fourth dose, what do you physically need? So, for example, do you need an ID, a driver's license, anything like that?
No, thank you for that question too, Chris. I was in Colorado Springs on Saturday with the Mexican consulate, and we were applying vaccines there. And we found that a group of people didn't want to approach our mobile health unit. And when we talked to them, it's because they said that they didn't have an ID or they didn't want to show us their address. And the thing is that some people believe that they need that. Right now, the only thing that we need is an arm and their consent to get the vaccine. We take the information that they write on a sheet of paper by heart. We do not need anything for them to prove that who they are. We don't need an ID with picture. We don't need an address, and we don't need a social security or insurance card.
So no information really needed. And Doctor, can you tell us more about the vaccine clinic that Servicios de la Raza is hosting tomorrow, Wednesday, not today, Tuesday?
Yes, we've been hosting open doors vaccines on walk-ins on Tuesdays from 4 to 8 at Servicios de la Raza. But tomorrow we have another event there, the same team. So we decided to move the clinic from today to tomorrow. So we're open. You don't need an appointment. You just walk in and we have the vaccines. The team is there. So you just come in and you'll get a vaccine tomorrow from around 4 o'clock to 7:38, depends.
Okay, so from tomorrow, from 4 to 8 p.m., Wednesday, March the 30th, there will be the vaccine clinic available. Now, once again, if you do have a question in either English or in Spanish for either of our guests today, please email me at chris.bianchi@9news.com, and I'll make sure it is answered in the coming weeks. But that will do it for this week's look at COVID-19 and the Hispanic community here in Colorado. Gracias a todos. Thanks to everyone, and we'll see you again here next week.
Thank you, Chris.
Thank you, Chris. Thank you, Vanessa.
Thank you.